you can catch anything early to keep it from exacerbating, becoming more pronounced, we're better off. Even on my medical homes and the clinics we set those up with the idea that they would be no more than 15 minutes from any workplace and no more than a 15-minute wait. We removed all the financial disincentives, so it's free care, close to you, available to you. So the whole issue is if we can remove barriers to care, we can take care of people earlier on. We can decrease the overall intensity of the illness state itself and basically also decrease the cost and the burden people are going through. And it works. It works there. It'll work in migraines as we push forward to help remove those barriers, increase that access, and increase that knowledge. If you thought you just had to suffer, but then now you find out you don't have to necessarily suffer, or you can reduce the amount of days that you suffer. I'm fortunate. I do not have migraines. I know plenty of people that do, and it's a miserable experience as they go into dark rooms without lights and just wait to die is the way they feel like, I know. So if we can reduce those numbers of those episodes, if we can help people learn what the triggers are so they can stop these episodes from occurring or reduce the amount of them, if we can get them on the right treatment regime that's right. I mean, it should be the right medication or the right treatment for the right patient at the right time. That's where we get the win. They have access to it, but we want to make sure it's the right treatment. Again, the right treatment for the right patient at the right time. We want to make sure, and we have to educate the providers and the patients to understand, you don't just jump to the high end. You work your way through your progress. You find out what works or doesn't work to make it the most beneficial to everybody involved. But there are some great new treatments out there. There are other medications modality. Every treatment's not for every person. It's an individualized approach. And so we need to promote that. We need to work with that. We need to educate our patients and providers on what they need to do to try to get to that right place. Many employees are basically not looking this, addressing this, or dealing with this directly. I think we as employers have to step up and understand that, yes, there are changes that are out there, pharmaceutical changes, therapy changes, things that need to be done and addressed, that instead of relying upon a fragmented educational system that's coming from diverse sources or no sources at all, we have to step up and get involved in the education and ensure that people are getting the right drugs and the right treatments at the right times. I think you have to understand its impact. It's like I said, we all know it's out there, but it's like when somebody takes a day off sick, we don't know why they're sick. We just know they're taking a sick day. We know that people are taking migraine medications. We know that it might show up in my database some, but migraines are so more pronounced, I think, on the workplace side than they are on the medical side. It's tend to be overlooked. Well, it's time to stop doing that. It's time to understand that, anything that's going to take a person out of the workplace on a regular basis that has such a profound impact, we have to step up and start dealing with it and try to understand what that impact would be. As I mentioned earlier, we are the medical home for 43% of our employee population. The specialized primary care that we deliver on, we also tell our folks is that it's when somebody comes in, you're not just dealing with a problem, not the presenting problem, but you're trying to deal with that whole person as a whole. And so what we have found within our own system is we've had our own individualized primary care patient-centered approach on things that gives the provider the time and the resources to work with their patients and gives that patient those access to the primary care providers. We were studied by the RAND Corporation as they reviewed our patient population versus the patient population of those attached to primary care in the community. And they showed that we had a net savings of about $62 per patient per month for those attached to our primary care versus primary care in the community. Well, the reason is it's that early intervention and access. It's the holistic look at the patient. It's being able to work with your medical staff to give them specialized training. As we roll out this summer, our migraine training program, our migraine programs, will not only be educating more our patients, but we'll be educating our providers more as well as we work to help everybody in that ecosystem be better, be healthier, and be well.